Hello, happy Nurses Week. This is a presentation about nurses and social media. Some of this information may be familiar and some may be new. I hope you enjoy and feel free to reach out to me using any of the social media platforms or email at the end of this presentation. A little bit about me as a presenter. I'm a doctoral prepared APRN, and my specialty is primary care. I have subspecialties in substance use disorders and behavioral health, as well as in education. In addition to my training as a nurse scientist, I also completed an extensive fellowship at Facebook, the social media company, where I was one of over 110 people selected as a Facebook Community Leadership Fellow. I am also a fellow at SONSIEL, the Society of Nurse Scientists, Innovators, Entrepreneurs, and Leaders. As a general disclaimer, I am not being compensated directly for this presentation. I do have a relationship with Springer Publishing Company in that they are the publisher for my book, The Nation of Nurses, a Manual for Revolutionizing Healthcare. The content that we'll cover includes a general introduction to social media, general guidance for using social media, general guidance for healthcare providers using social media, specific guidance for nurses using social media. So what is social media? Essentially, it's a computer-based technology that facilitates the sharing of ideas, thoughts, and information through the building of virtual networks and communities. By design, social media is internet-based and gives users quick electronic communication of content. Most social media applications are available online and accessible through applications on your average smartphone. As a rule, social media users can create as well as actively or passively interact with content and other users. The type of content and interaction between users will vary between social media platforms. Interacting with content and other users may include signaling approval or disapproval of content, using text to communicate, and posting or creating text, video, or image style content. There are over 100 social media platforms that I'm aware of, and that number is growing constantly as new platforms enter the market. Some platforms nurses may collect information from include Facebook, Twitter, LinkedIn, Instagram, and Pinterest. However, nurses are a very diverse group of people, and it is likely that all social media platforms have nurse users. This presentation will primarily focus on the most common platforms. However, many of the principles can be applied in general to all social media platforms. The most popular social media platform is Facebook by a significant margin with over 2.6 billion users. YouTube has 2.3 billion users. Instagram has 1 billion users, which is a company also owned by Facebook. You can also see that as popular as Twitter seems, by comparison, they only have 192 million users. Less common social media platforms include Reddit, Snapchat, Tumblr, Quora, Meetup, SoundCloud, Flickr, Yelp, Imgur, and Parler. There are dozens of other social media platforms that serve a variety of uses. I'll provide a link to a list of other platforms at the end of this presentation. Now let's get into some of the more important pieces of content. General guidance for using social media. Here we talk about conscious use and intentional interactions. And by intentional interactions, I mean be intentional about your presence on social media and be intentional with your actions while using social media. So things that you can think about are, who am I while using social media platforms? People can assume many different identities or versions of themselves while interacting online. A person could assume an identity as an employee, a grandparent, a sibling, an antagonist, a poet, a business person, a cat lover, a parent, a political activist, or some version of all of the above. We should also consider what platform are we using and how does it work? We should also think about why are we using this particular platform? Who is the primary audience that may see the content? What kind of content am I interested in consuming or interacting with? Who can see the interactions and content that I am interacting with? And who do I want to be able to see the content that I'm interacting with? These are all considerations to think about when using any type of social media platform. Algorithms, feed versus truth and reality. When we think about social media platforms, you can think about algorithms and how they affect your perception of truth and reality. The content we receive through the algorithm can seem synonymous with truth, but this is not quite as it seems. Generally, the platforms use an algorithm to feed users more information that the users like, and thus the users stay engaged on the platform. The longer the user is on the platform, the more likely they'll see an ad and possibly engage with that ad. Social media companies generally generate revenue from people who want to sell ads. This is why the more a user interacts with a certain type of content, the more likely they'll see more of that kind of content. This system makes it easy for a user to passively consume a single type of content and potentially skew the user's reality of available information. As a rule, we should always assume that all information routed to us through social media is a version of artificial intelligence or a machine learning our behaviors and attempting to keep us engaged on the platform. We should always seek a variety of sources when consuming information from social media platforms. The online versus offline myth. There is a general misconception that there is a huge divide between online and offline activities. However, we know that isn't true. For example, a person may see an advertisement for a movie on Facebook. They may have a text conversation with their friend about going to the theater on their multimedia phone. They may purchase the tickets online. They may attend the movie in person, then tweet about the movie the next day. They may add an angry face reaction emoji to a Facebook ad about the movie, then write a comment detailing what they disliked about the movie. This is the reality of how we consume media and content. While this person is having this experience, they aren't thinking about online versus offline. They are just living their lives as a consumer. Moreover, the COVID-19 pandemic has shown the world that many people can conduct work remotely and much business can be conducted online. As a rule, we should not think of virtual spaces and physical spaces differently. We should think of virtual spaces as a continuum of interaction possibilities that may occur at any time before, during, or after our interaction with physical spaces. Now we can talk about general guidance for healthcare professionals using social media. Employers may check your social media platforms prior to hiring. Additionally, your current employer may review your social media accounts and they may be able to take action if your social media content is harmful to their company or brand. Some things to consider before interacting on social media are: can my employer see my social media activity? And do I mind if my employer can see my social media activities? Can engaging with this content on social media or engaging in this activity on social media be harmful to my employer or for my reputation as an employee? If so, we should consider changing our settings to limit the view of to select groups of people that can access our um, engagement and activities online on social media platforms, or reconsider if the activity is worth engaging in at all. Colleagues can also review and check our social media activities. So again, we want to consider before we interact online on a social media platform, we should think about can and ask ourselves, I guess, can my colleagues see my social media activity? And we should ask ourselves, do I mind if my colleagues see my social media activity? If I don't mind that they see my social media activity, I suppose there's no reason to stop engaging in the activity. However, if I do mind that they see the activities, I should consider either limiting who can see my activities or um, rethink whether or not it's worth making the post or engaging in the activity online. Sometimes it can be a small thing that may trigger our colleagues to think differently about us. So we should always consider the image that we are putting out online. The healthcare consumer community, in other words, patients and their families, may also check our social media profile and presence and activities. And so before posting or engaging in activities online, we should consider, can the patients and the communities that I serve view my social media activities, and do I mind if they see my activities? Um, Again, if we don't mind that they see our activities, I suppose we can continue with the activities. But if we do mind, and we do think that it could be harmful to our reputation as professionals, we should reconsider whether we should post the content or we should limit who can see the content. And there's a way to do that in your settings on any social media profile or platform. Some specific guidance for nurses using social media include our circle of influence. Nurses are the most trusted profession, whether we like it or not, and people who know we are nurses and see our social media interactions are influenced by our behavior online, by our opinions, and by our ideas as nurses. So our influence may have good or bad consequences for people's health, behavior, and choices. So we should always consider our circle of influence and who has access to our activities online in social media platforms. Additionally, um, nurses and really all healthcare professionals um, struggle with lack of support or feeling mistreated or unsupported in general in their work. And the nursing community specifically has been broadened by this availability and access to each other through social media platforms. So, whatever nursing niche a person is into, there is a community of nurses out there who are into it as well. And if the community you're looking for isn't available, you can start it in a few minutes by using a social media platform. So, community is one huge benefit of using social media platforms. And last but not least, self advocacy. This is one of the main features of my book. in that there's a discussion on how to use social media platforms as individuals and as community of healthcare professionals to better serve as self advocates. And by self advocate, I don't mean advocating for our patients, I mean advocating for ourselves as healthcare providers, as nurses, employees, and as citizens within our communities and of the world. These social media platforms allow nurses to gain instant access to each other, as well as other people, organizations, and institutions. These social media platforms allow nurses to band together around shared values, plan and make decisive actions towards improving their lives, the lives of their patients, and people all around the world. I believe as nurse self, excuse me, I believe nurse self-advocacy is the key to revolutionizing healthcare as we know it and is the primary reason for writing this book. If you, as a nurse or a nurse educator, are interested in learning more about nurse self-advocacy, as well as the intersection of nurse self-advocacy and social media, I encourage you to check out my book, The Nation of Nurses, a Manual for Revolutionizing Healthcare. Just as a quick recap, we covered an introduction to social media, what it is and how it works, some general guidance for anyone using social media, specifically for healthcare professionals using social media, and also specific guidance for nurses using social media. Uh, Here is my contact information if anyone wants to give me some feedback about this presentation, contact me about other opportunities, or find out more about my work. Feel free to contact me through direct message or email, and here are my contacts. Lastly, this is a link to uh, um, the social media platforms that I discussed earlier in the presentation, as well as a link to my book if you wanted to check that out. Thank you very much. Have a great day.